Hello and welcome to our live stream. We're so glad you're here. We've got some people still joining, but we're going to go ahead and get started. This is our second episode of Strategic Staffing 24/7. The series has been created to give nursing leaders the insider information, tips, tricks, tools, hacks, however you think about it, to keep your shift fill rates at 100% and your patient satisfaction high when you're working with staffing agencies and agency clinicians. I'm Ethan Potchman, and this series is sponsored by Integrated Healthcare Staffing. I'm here with my co-host and long-term care staffing expert, Trisha Stackhouse, and she's Vice President Operations at Integrated. Hi, Trisha.
Hey, Ethan. Super excited to get this one underway. As we prepare for Halloween, there's a lot of people thinking about trick or treating, and I'm one of those as well. So I'm really hoping that we can share some treats today and not so many tricks as we talk about compliance.
Yeah, awesome. And we're going to be hitting the truth about compliance in agency staffing. And there's some important things to know, and we want to share all of those with you. All right, so last week, we talked about what to do to get clinicians to prefer your facility, agency clinicians who have a lot of choices. And we're going to, if you haven't already seen that, the link is available and we can share that with you if you haven't received it. But as we jump into the truth about compliance in agency staffing, we want to take a look at the poll results here, and that'll give us a sense of where you're coming from. Let's see. So question one, Trisha, it looks like everyone is only somewhat confident in the level of compliance. So that's pretty interesting. Let's see if question one comes up. All right. So the feeling is that both the facility and the agency is responsible. Trisha, I know you have a lot to say about this topic. Curious about your response to these poll question answers, as well as whether you believe there's kind of an overarching truth to compliance as it relates to agency staffing.
Yeah, I'm actually not surprised by the results. I'm probably pleasantly surprised that our participants feel like both the facility and the agency are responsible for compliance and credentialing, because that's absolutely true. I think that some agencies do a very, very good job at managing compliance, and some agencies are doing the bare minimums. Most facilities I've encountered and talked to assume that the agency is doing a good job. And what we've discovered over the last several years particularly is that that's not always the case.
Yeah, I really like what you've said about the bare minimum. And I think one of the things we'll expose today for our audience is what is the bare minimum, and then people can take a look at whether that feels like it's enough. And I'm guessing most people won't think it is enough. So before we get to risks and kind of the details of this topic, is there a list of legally required compliance items, Trisha? Is it long? Is it short?
I guess at the very bare bones, you have to have a license. You have to be licensed in the state where you're going to work. I mean, that's probably bare bones minimum. But beyond that, there are certain things that should be required, and it's up to facilities and agencies to work together. Things like a basic life support card, a TB test, COVID vaccinations, background drug screen, experience levels, is there core competency testing? These are all the types of things that Integrated does. And we want to make sure that facilities understand what all of their agencies are doing and that they're really comparing apples to apples and not apples to oranges.
Well, that's a pretty impressive list, but I'm actually personally shocked to hear that most of those are optional, right? You're not necessarily doing anything wrong if you don't do those, but it sounds like you're not doing a lot of things right. And I'm guessing most facilities would want to have that type of background check to have that confidence in the people that are coming into their facility.
Yeah, absolutely. I mean, and I think there are things that facilities assume are being done, but I think the question is, are they being done and are they being inspected and verified?
Yeah. So let's in a minute, let's talk about how our facility partners here, our audience, can learn what's being done by their agency and make sure they're comfortable with that level. You mentioned something that in the list that's very pertinent to right now. You talked about COVID,
Mhm.
and I'm curious just for a quick overview of kind of where things stand with COVID compliance and what's being done, what's really needed. What's your point of view on that?
Sure. So, of course, when the pandemic started, everyone was very interested in finding out about COVID vaccinations. And then, of course, we had accommodations for medical and religious reasons. And that is something that your agency should be managing, inspecting, approving. Whether or not boosters are required or not is really facility to facility, but that is something that the agency should be checking. Um, there's other things though as well. I mean, as we move in and out of different levels of community transmission rate, it's important to note, is your agency adhering to the requirements of weekly testing, or are they leaving that all up on the facility? There's also, other things that are required, that I don't think agencies have asked, at least in the years I've been doing this. I've had very few agencies actually ask, do you do this? Do you do this? What are your expectations on that? Not the same type of focus as we saw during COVID with vaccines and boosters and accommodations.
Okay. Okay. Got it. Well, that's good background. Um, one thing that I'm curious about, put yourself in the shoes of these folks who are in the audience today at the facility. Um, what are some of the risks that they're taking if they don't understand, what level of screening is happening? Think about it in terms of both service level, which I think is a really fascinating idea, and then as well as risks, true risks that are being taken. What are your thoughts on that?
Sure. I mean, at the macro level, we talk about service level. These are things that are taken care of if your agency is doing things like setting minimum experience levels, not only length of time that someone has worked in a particular certification or role, but are they working in a similar setting? There's a big difference between sending an RN into a long-term care facility that's been a nurse for 10 years, but the last 10 years they've been working in a doctor's office or in a hospital.
Yeah.
Even though they've been a licensed nurse, their experience doesn't translate well. And so that's going to really impact the service level of the residents where they're being assigned. From a risk perspective, you talk about things like a CPR card, right? And a lot of agencies will say, yes, we require a CPR card, but really you almost have to dig in a little bit deeper than that. Is it the healthcare level BLS card, or is it just the basic CPR card that you get if you're going to go babysit your neighbors? Is it an in-person skills validation BLS, or is it something that they just did online, right? That can really translate to some risk for a facility if you have someone who hasn't completed the required BLS at the healthcare level, and there's some type of incident at the facility, and that agency staff member is the one to respond. Obviously, there's going to be some investigation and some risk there as well.
All right. So being very current and very thorough really does play an important role. And it sounds like there's the issue of maybe not getting what you thought you were paying for, maybe not getting a person who's truly drop-in ready, and able to handle everything your facility might throw at them. But also there's kind of this concept of horror stories or moments that things really go wrong, and you're just, the stack up it produces a really bad outcome. I understand that you recently had a good experience gaining deeper insight into this, and I know you've also heard stories from facilities. Can you tell a couple of the stories or experiences you've had that made this real for you?
Yeah, I think one of the reasons that we really decided that this was a great topic to share is Integrated had the opportunity to expand our relationship with one of our clients and manage their vendors, what we call an MSP program, which essentially means we take their existing vendors and we bring them under contract with us so that we can manage all of their staffing for them, from contracting, credentialing, staffing, reporting, invoicing. And so part of that process is re-vetting their existing vendors. Now, keep in mind, these are not new vendors. These are people that were already servicing their facilities. The client was under the impression that all of these vendors were delivering their list of credentials that were in their contract. And as we started reaching out to these vendors to get them onboarded and reiterate what those credentialing requirements were, I was surprised, amazed, a little horrified to find when I was talking to certain vendors, they would say things like, is the BLS card really required? Because we don't do that. Or do I really have to do a drug screen on everyone that I send out? Because we don't do that currently. So here the client thought they were getting one thing and the vendor was delivering something very different. And it really brought to light the fact that facilities may not realize or look at what they're actually getting versus what they expect that they're getting.
Wow. I mean, that makes it real. Let's shift gears a little bit then, because you're bringing a lot of that experience, not just this most recent experience, but many years of a commitment to this higher level of compliance, which includes what I'd call vetting, really matching the candidate to the need. Can you talk a little bit about those extra things, the above and beyond that you're doing, and I would say other strong agencies are doing to be able to really deliver that highest quality and not just the bare minimum?
Sure. Yeah, I mean, I think it starts with making sure that your agency does have those experience and testing requirements. So think, are we validating core competency that whatever licensed professional might need to have? Are we looking at their skills? How much experience and confidence do they have in the various items that are part of scope of practice? Have references been done? And not just references, but references from bedside clinicians that can really talk to a person's skill set, not just a verification of employment, dates of employment through HR. Looking at the experience, making sure that it's recent. So for example, if at our agency, if we were to hire a nurse, we require them to have a minimum of 12 months of experience in the last 3 years in the same setting. So if they're going into long-term care, they have to have long-term care experience. But beyond that, it's doing all of the things that you might do if you were hiring someone in your facility. So verifying that healthcare level BLS card in-person class, making sure that someone has a TB in the last 12 months, running a background check, a drug screen, the OIG EPLS screening to make sure someone's not on an exclusion, and then really understanding what the state requirements are as well. So for example, in Oregon, we have to go through DSHS and do an orchards background. In Colorado, we have to do a CAPS check. So not only are we doing agency level, but we're also making sure we do state level and then even going down into client level, because certain clients have different requirements that might be a little bit more stringent.
Okay. So that sounds like a lot of extra work. And, it sounds like good news for the facilities that extra work is being done. What I'm hearing from you is that the best way to do compliance is not merely to stop with the legal requirements, but to go above and beyond into the areas that actually are going to ensure the best possible fit. And I think about that as having a shift where the clinician is truly drop-in ready. The match, the fit is so good that they jump in and they are delivering value from the first minute. Can you talk at all about that concept of drop-in ready, and if that's a conscious effort on your part and your team's part? I think that's probably a high value for the facilities, and it sounds like some agencies don't think about it that way, but I think you do.
Yeah, absolutely. I mean, I think probably the best explanation I give is when our recruiters are looking at someone's experience, obviously we're not just looking at how much experience they have and when their experience is, but we're really looking at what type of experience do they have, and how flexible are they going to be? Because when you're working as an agency employee, that flexibility is really critical. So, just as an example, you might have a clinician that's worked the last 10 years at the same facility. It might be a long-term care facility similar to what they're going to do working as an agency staff member. But we're also screening and vetting to make sure that this is someone who's going to be flexible to be able to adjust. The last thing that a facility wants is someone who comes in and says, well, that's not how we do it. because they've only been exposed to one way, because they've only been at one facility for the last 10 years. We want people that are going to come in and essentially act like a guest in someone else's house and follow that guest's house rules.
So I hate to go negative here, but I'm guessing you've heard a couple stories from clients who have experienced people that weren't at that level, who weren't drop-in ready, who weren't flexible. What are some of the cautionary tales that you've heard as they've said, yeah, those people don't help me very much, and it's actually more trouble than it's worth?
Sure. Well, I mean, obviously our facilities are already short-staffed. That's why they're using agency. I don't think I have any facilities that say we prefer to use agency over core staff. So we need to have people that are going to hit the ground running. And some of the impacts of this is that someone does show up and they've only worked in a hospital, or they haven't worked in a long-term care setting for 10 years and things have changed. So they're not familiar with charting systems. They're not used to patient ratios. They don't understand how to read or interpret care plans. And so those are some of the things that, again, having that recent experience in the same setting really makes them able to just jump in and hit the ground running.
All right. So let's start giving some practical advice to our audience here in terms of what they should do in order to confirm that the methods and the checks and the depth of the things that are verified are what they're really looking for. What can you recommend to them instead of maybe a long list of questions? Are there principles, or are there key ideas? What advice would you give?
Yeah, I mean, I think, it just starts with making sure that you understand what you're getting. So whether that is looking at the staffing agency's contract and seeing what they're promising to deliver, or asking for a list of what their compliance and credentialing includes. I mean, that's kind of first and foremost. Obviously, making sure that they have some process in place to keep these things current. It's not enough just to do the initial check, but we know these things, they expire all the time. And so what's their process for keeping those things current? Have some way to verify. Obviously, the easiest way in today's business market is if your agency has some type of portal that gives you visibility directly into the credentials and the documents, which, on a side note, makes it awesome if you're ever in a state survey audit and the auditor's there and says, well, how do you know? And you can just, oh, I'm in my portal and I pull it up.
Yeah.
But if you don't have that, your agency may need to ask for an email of certain credentials, which can get complicated. It does create extra work for the facility. Perhaps an attestation from the agency just stating that, yes, we have all of these things on file. But obviously we want to keep it simple, and that's why that portal can just make it super easy, because you just have access when you need it.
All right. Thank you for mentioning that, because that does sound very slick and very good to, certainly in an audit, but also, like you said, whenever you need it, whatever the reason is, you just want to quickly check and remind yourself it's always available. Just curious, what type of complexity let's use the integrated portal, for example, since you know it so well. What types of things is it capable of tracking and providing? And is it able to meet all the needs and all the requirements that a facility might have, some of which may be unique?
Sure. It gives direct visibility. So when a clinician is assigned to a shift at a facility, that facility has automatic access into that clinician's credentialing record. So it will show things like their license, their BLS card, their TB results, not only that it was done and the date that it was done and the date that it expires, but actual view the document, right? So you can actually pull that document up, and not only the current one, but if this is someone who's been with, you for a while, maybe worked the last 6 months, you can see their last BLS as well as their current one. But you're right, a lot of facilities do have kind of one-off things. So I've got a couple of facilities that have certain policy or procedures that they want signed off before someone shows up, or they want to make sure that they read a certain training before they show up. So we can get those documents from the facility, put them as a requirement at the facility level to ensure no one gets booked without signing them, assign those to our clinicians, and then once they're signed, they're visible so that facility can go, oh, yep, here it is. They signed off on our charting policy. They have a copy right there. Again, they're not having to create files, save documents. They can just go in the portal and view it, verify that it was done, and have access to it when they might need it.
Well, that's great. It sounds like a wonderful summary as well of the best practices and things that a top strong agency is going to offer you. And we do hope that you'll join us 2 weeks from now on Wednesday, November 2nd at the same time for Managing Agency Staff, Coach, Cancel, or Can. And the idea here is, what are the best ways to get the most out of the staff you have? And how do you think about when you're not getting the level of performance that you're looking for? And we've got some great recommendations there. And we are really, really grateful for the attendees and would encourage you to invite others that might find this valuable as we continue to talk about the ways to have strategic staffing be a part of your approach 24/7 and really 365, because we know you're open all the time. Thank you for attending. You're doing such important work, and we're grateful for your time today and for all that you do to serve others. So until next time, here's a quick closeout with some contact information, and you can reach us with any additional questions you might have or any way you want to get in touch. You've got your local branch contact info and also direct information for Trisha. Thanks so much. Until next time.
Thanks, everyone.